Hello, my name is Simon Dennis, and I'd like to thank you for inviting us to share some of the work that we've been doing looking at mobile tracing technologies for the COVID-19 pandemic. So it's clear now that COVID-19 is a global phenomena that has been having a huge impact on societies across the world. At latest count, there were 36 million people with known infections and over 1 million people that had died. And so there's a real premium on coming up with technologies and methods that are able to prevent the spread of the disease. So one of those methods or technologies is smartphone or other kinds of automated contact tracing. So the idea behind automated contact tracing is that if we have one person who has become infected, and we know that, then what we'd like to do is stop the spread of the disease through their contacts. And so if we can quickly identify who might be at risk, we can ask them to self-isolate and therefore potentially prevent the spread. So for instance, if this person is infected, if we're able to quickly identify this person as a potential infection, then we ask them to isolate, and that stops the spread to all of these other people. Now, in order to be able to do that, though, we need to be able to identify when people were in close contact with each other, and not just at the time that we know the person has become infected, but in fact before that point when they would have been infectious and could have spread the disease. So, the use of smartphone technologies or other contact tracing technologies can really help us to do that, provided people are willing to actually accept them. And so that's a key element, and one of the things that we were very interested in investigating. So the project has been an international project. So far, 9 countries have participated with their own surveys, and they include Australia, the UK, the US, Germany, Japan, Taiwan, Spain, Italy, and Switzerland. Now, in each case, the situation has been somewhat different. It's different as a consequence of where the country is in terms of the spread of the disease. It's also different in terms of the kinds of technologies that are being contemplated in that country. And so the surveys have been somewhat different in each case. But what I'm going to do is give an overview of the kind of prototypical survey, if you like, and then just be aware that different countries have implemented different surveys at different times. The first thing to say is that where possible, we've attempted to stratify our samples, and we've stratified by age, gender, and region of residence. You can see some of the results there from the Australian samples. Perhaps one thing to note is that in general, our samples have tended to be on the higher education levels, so more graduates from universities than would be typical of the general population. But otherwise, we've attempted to stratify in most cases. Now, this is the overall pattern that our surveys have taken. So there's been a demographic questions to begin with, and then we've asked a series of questions about the perceived harm or risk or concern over COVID itself. We've then asked about what people believe the impact of COVID is, and then some questions about getting people to estimate how many fatalities there have been in their own country as well as other countries, and also to estimate to the degree to which people in their country are complying with any government regulations that are in place. We then gave people, each person, one scenario. So they each received a description of a particular technology that could be introduced, and all of the subsequent questions are related to that technology. We then asked whether that technology was acceptable, In some cases, we asked them, would you download this technology if that was appropriate? Or when the technology already existed, sometimes we asked, have you downloaded the technology? And so there, obviously, those are somewhat different questions, and as you'll see, there's quite different answers. Then what we did is we asked a series of questions about the effectiveness of the technology, what people believed about that, and then what they believed about the potential harms of using that technology. And so that would be related to things like invasions of privacy and so forth. We then asked a second acceptability judgment. We did this to allow us to get a sense of to what degree being made aware or foregrounding some of these issues about effectiveness and harm, to what degree does that actually influence people's judgments of acceptability? If people said no, that they didn't think it was acceptable, we also asked some follow-up questions. So we asked, for instance, would they find it acceptable if there was a sunset clause, which said that this would only be used for a set amount of time and then would be discontinued. And then if they still said no, we also asked whether it would matter if there was an opt-out, so the ability for people not to be involved. In some surveys, we also asked about immunity passports, and also in some cases about people's general worldview, so to what extent were they libertarian or not. So the perceived harm and risk questions were the following. So how severe do you think the novel coronavirus will be for the general population? How harmful would it be for your own health? And how concerned are you that you might become infected? And how concerned are you that somebody you know might become infected? We also asked, have you ever tested positive to COVID-19? Has somebody you know tested positive to COVID-19? There weren't very many people in either of those categories in our survey. And then how many days, if any, have you been in quarantine or self-isolation? So as you can imagine, if people who have been in these isolation kinds of situations might have a different opinion than those who haven't. And so we thought that might matter. We also thought that whether a person had lost their job as a consequence of COVID-19 might impact their decision-making processes. So we included that. Then we gave them a set of scenarios, and the scenarios were designed to cover off on different kinds of variation in the possible technologies. So one was the kind of technology that was being used to do location tracking. So was it done via telecommunication networks, which case it applies to all phones? Was it done via GPS tracking, in which case there would be a record of people's specific locations? Or was it done using Bluetooth tracking, in which case the contacts would be retained, but not the locations of people? We also asked them about, or had scenarios that talked about either centralized or decentralized storage. So did the technology involve some central repository of information about individuals, or was it completely decentralized, so just spreading from one person's phone to another person's phone directly? So this gives you an idea of one of the scenarios that we used. So we started with some general comments about the pandemic, and then we highlighted some key aspects of this particular scenario. So in this case, we're talking about a mandatory government mobile network tracking. And so we highlighted all people using a mobile phone would be included in the project with no possibility to opt out. The data would be accessible only to the Australian government, who may use the data to locate people who are violating lockdown orders and enforce them with fines and arrests when necessary. So we tried to pull out those specific items that were really the crux of the scenario, and to make sure they were highlighted in people's minds. And we also had people go through a comprehension check to make sure they were reading carefully. Once we've done that and we've asked our acceptability question the first time, we then ask the effectiveness and potential harm judgment. And all of these were on Likert scales. And so the effectiveness questions that we asked were, how confident are you that the described scenario or technology would reduce your likelihood of contracting COVID-19? How confident are you that the described scenario would help you resume your normal activities more rapidly? And how confident are you that the described scenario would reduce the spread of COVID-19? So those are all focused on, did people think this particular technology would be effective? The harm ones were focused around what was the cost of participating in the use of this technology. And so that depends on a number of different aspects of the technology. And so we're looking at understanding how people thought about these different technologies. So we asked things like, how difficult is it for people to decline participation? To what extent do people have ongoing control of their data? How sensitive is the data? How serious is the risk of harm from the proposed scenario? How secure is the data? To what extent is the government or Apple, Google only collecting the data necessary to achieve the purposes of the policy? Do you trust the government to use the tracking data only to deal with COVID-19? And do you trust the government to be able to ensure the privacy of each individual? So those were the questions we asked. And that's all I'm going to talk about today. The questions or the results and conclusions will be addressed by subsequent speakers. But if you'd like to get some more detailed information, there are a number of links, one to all of the results from the different countries, and then links to two papers which are currently available, one about the surveys that took place in the United Kingdom and another one about the surveys that took place in Australia. And I know there is one coming shortly for Taiwan. So thank you very much to my collaborators. So Paul, Josh, Jen Pa, and Stefan will be speaking to you shortly, but there have been another number of other people who have also been involved in the project. Thanks very much.